End-to-end design of bespoke, dexterous, snake-like surgical robots. Have you ever wondered how difficult it is to perform minimally invasive surgery? In the arthroscopy, the surgeon has to manage multiple rigid instruments while manipulating the patient's leg and watching a monitor. This is ergonomically challenging and involves limited visibility and control. This is because the current instruments are rigid and inflexible. They cannot specialize to patient cases, and they can be suboptimal in irregular anatomies compared to a tailored surgical device. One survey found that current practices do result in unintended damage to the patient. Almost all surgeons find it difficult to visualize inside the knee, and there is a demand for robotic surgical systems if they could lead to safer, more efficient, and ergonomic outcomes. This is where our research comes in. SnakeRaven is our concept of a telerobotic system for keyhole surgery, which brings an ergonomic setup for knee arthroscopy. It is a macro-micro manipulator, combining the motion of a micro snake-like end effector arm with a macro Raven 2 general-purpose surgical telerobotic arm. The steerable snake-like end effector could have the degrees of freedom to increase tool dexterity, reachability, and camera field of view. It could perform the intervention with laser from only one incision. When made with low-cost 3D printing, designs can be customized for patient-specific treatment. However, creating them is a challenge. We don't know how to optimize them with the task's dexterity and patient-specific constraints. We also don't know how to specialize the design to the patient's anatomy. Current approaches in the literature have explored volume-based metrics for achieving workspace reachability, optimizing dexterity, and path planning in patient-specific environments. However, no study has optimized dexterity in constrained spaces such as the knee. There is no exploration of whether we should specialize or generalize a task. And lastly, we haven't looked at how the design can vary between patient cases. So our contribution is to develop our automated end-to-end design workflow for creating bespoke end effectors. To do this, we developed an algorithm for achieving high dexterity in confined spaces using the notion of orientability. This is a measure of dexterity determined by all end effector tip orientations as a region on the surface of a sphere. Lastly, we explore the advantages of design specialization compared to generalization by observing how the design morphology changes between different patient tasks. In our end-to-end design workflow, we start with a patient scan to create patient-specific end effectors. The scan captures 3D information of the anatomy considering the task of reaching 4 targets that represent common lesion locations. Next, a voxel grid is created, where targets and obstacles are segmented. In the optimization stage, up to 6 parameters need to be solved for the end effector design. The design that gets the best dexterity at the targets in the knee would be the optimal solution. Each parameterized design is assessed based on our orientability index. This is determined by sampling the robot workspace for collision-free configurations that reach the targets. The fitness function is multimodal and highly nonlinear. We optimize it using differential evolution, which iteratively searches for a design until the fitness converges. Comparing our generated designs proved that our solution achieved 3 times the dexterity of a rigid tool and twice the dexterity of a volume-based approach from the literature. Fabricating the design and validating it in a phantom showed that the simulated results are accurate to the actual robot workspace and dexterity. Exploring the relationship between design and task, we developed designs specific to each target and tested the designs on a new target compared to a general design. We picked a new 5th target, chosen as the ACL, which is a relatively difficult target to reach. We developed an obstacle occlusion index to measure how difficult it is to access the targets. The targets can be difficult because there can be obstacles neighboring it, or it could be difficult because there are obstacles blocking the direct straight line route to it. When generating designs specific to each target, we found that the specific designs always outperform the general design. The achieved dexterity at each target also differs significantly, as each target varies in difficulty. At the new target, the general design struggled, while a specific design significantly outperformed it, highlighting the importance of specialization. These designs created by our algorithms have features that mimic natural manipulators significantly. They developed small, free-jointed distal wrists that are high curving to achieve high dexterity. They also prioritize easier-to-reach targets to greedily achieve high fitness. In conclusion, we created an automated design pipeline for making highly dexterous manipulators. Our design has more dexterity than a rigid tool or a volume-based approach from the literature. We also validated the design in a knee phantom and found that specializing the task was always better in performance than generalizing it. We also observed design trends and guidelines for achieving high dexterity in our automated solution. Thank you for watching.